Hi, this is Kirk Umber with AtlasMD, and in this video we're going to do a brief demo of the AtlasMD EMR. For those that are new to Atlas, we originally started building the software out of necessity for our own direct primary care practice that we opened in 2010 in Wichita, Kansas. We continue to grow and because we're passionate about growing the DPC movement and creating a better model of healthcare for doctors and patients. And what we're going to do here is we're going to walk through a single patient visit. So starting from the very beginning when they enroll with the practice to getting them set up in the system and billing and scheduling and charting and putting in orders and things like that. All right, let's go ahead and start with the enrollment. So your Atlas account comes with its own unique online enrollment form, and you can copy and paste that onto your website. This is our clinic website. So we have a Get Started button, sign up. Patients can go in and start filling out all their information on the website. Then the clinic will be notified of a new patient enrollment, and then all you do is hit confirm, and then it will populate all their information into a new chart. All their past medical history, all their contact information, and their credit card in their billing section. And then after the patient is confirmed, they will receive a welcome email. And what most clinics will do is include their Atlas phone number and their email address. So part of the included features is the ability to set up a phone number, and that will route back to your actual cell and then sync the text messages and calls to the patient's chart. Now you can have this delivered via SMS or to the AtlasMD mobile app. You can access the EMR through the browser on your phone, or for a more seamless experience, you can use the AtlasMD mobile app for messaging, viewing lab results, your schedule, tasks, and things like that. All right, once the patient is confirmed, then they get the welcome email with your phone number, and with your email account, you can link your email account to the mailbox section here. So then that way, anytime you have emails back and forth with the patient, those automatically sync to their chart as well. All right, usually as a first step, what we'll do is we'll go ahead and double check the patient's billing. So you can set up various pricing structures. There's age-based pricing, fixed rate pricing, or you can always do a custom plan. We see a lot of clinics do age-based pricing. So generally that's less for kids and healthy adults, young healthy families, and then more for older adults through the various age ranges. And then the benefit to that is as a patient ages into a new tier, then their subscription price automatically updates and there's nothing more that you have to do. And the payment processing is all integrated, and the processing fees are 2.1% plus 30 cents per online transaction for any credit or debit card. And that's a blended rate, so there's no upcharge for American Express or anything like that. Bank accounts or ACH drafts are just a flat 25 cents as well. And you can always do a cash check or other payments, but those have no fees because there's no electronic transmission happening. All right, and then we also have billing set up for companies. So you may have employers that want to set up an arrangement to where they can pay for their employees' memberships with the practice, and that's very easy to set up. And you can set various coverage percentages. So if they said, well, I want to cover 100% of the employee's subscription, and then they're responsible for everything else, very easy to do. And the employer will have their own login to the company hub, and this is where they can add or remove employees, they can make payments, contact the clinic, things like that, all from their own hub without having to reach out to the clinic. All right, so after we've got the patient set up, they're on auto charge. You can take payment at the time of service or just allow them to be on auto charge to where it'll run for their monthly membership and any incidentals like meds or labs. All right, we'll go ahead and schedule the patient's first visit. So we can schedule from their chart, and the patient can be set up to get automatic appointment reminders. Most people will select text message to receive those. And there is also the option for the patient to self-schedule through the app. So there's an AtlasMD patient app as well. And they can log in and contact the clinic, manage the upcoming appointments or schedule future appointments, manage their billing, download invoices, make payments, all sorts of things like that. With the self-scheduling, you can set parameters to that. And so there's lots of options for customizing the self-scheduling to your liking, or you also have the option to turn it off if you wish. All right, so we'll go ahead and let's say the patient is here. Usually as a first step, we'll go ahead and add in their vitals. So we'll go ahead and add those in here, and there's standard vitals, but you can also track custom ones as well. And then those will get automatically graphed in the patient's vital section. There is an option to connect to health wearables. So whether it's Apple Watch, Garmin, blood pressure cuffs, scales, any sort of things like that. So that way that information can just come right into their chart. We do have pediatric growth charts in there as well. So for pediatric patients, it'll automatically graph those. And we use the WHO for growth charts for ages 0 to 2, and then CDC for growth chart or for ages 2 and up. And then there are Down syndrome growth charts in there as well. So if you have a patient with a diagnosis of Down syndrome, then it'll automatically convert the growth charts to the Down syndrome growth charts. All right, so after we put in the vitals, let's go ahead and look at charting. So there is AI charting included. So what you can do is you can upload a recording of the visit with the patient. The system will automatically transcribe the visit, even if it's an hour long, 2 hour long, anything like that. And then there's the AI button over here to generate a SOAP note based off of the transcription. Add note. You can always make edits if you need, anything like that. And there's lots of ways you can even add prompts at the end to maybe you want your notes formatted in a certain way, or just any additional instructions for generating the notes. So lots of customization for that, and all included in the software. And you can also use macro templates, so like #strep, and it can populate in your own strep throat template that you'd like to use. You can make your own custom templates, or you can pull from other physicians' templates in the macros section under community macros. So you can go to community macros, search for other templates from other clinics, and just add those to your account. So then you're not having to reinvent the wheel. All right, so after we've added in the note, let's go ahead and dispense a medication. So the software is set up for you to handle your own in-house pharmacy. So you can manage your own inventory for NDC items or non-NDC items. So basically anything that would require a prescription or anything else. So it could be supplements or durable medical equipment, anything like that. In this example, we'll go ahead and dispense from our inventory. So you just start to type the medication and it'll show you what you have in stock. I've got this saved as a favorite, so we'll just grab that. Add drug to prescription. And then it will give you the option to dispense and print. And so this will update your inventory quantity based on what you've prescribed. This will generate the prescription bottle label that you can print and stick on the bottle. Patients can scan QR codes for refills, so that really helps cut down on phone calls and everything. And then the billing for it will get automatically added to the patient's invoice as well for their upcoming invoice. And you can also ship to the patient. So in their contact details section here, you've got the options to generate a shipping label. So we've got an integration with USPS. So you can generate those labels and ship those to patients for convenience if they live outside of town or anything like that. So very easy to do. We also have an integration with goodbill.com. This is for looking up best hospital prices in your area based on that patient. And then we also, with our partnership with Goodbill, anybody that's using Atlas, their patients have access to their hospital negotiation services for free. Normally, Goodbill would charge a percentage of the savings that they're able to negotiate down on the hospital bill, but through our partnership, there's no cost to the patient. All right, so we've dispensed our medication, and in the inventory section, you can view what you have. Here, we order most of our medications through andameds.com. We also have a group purchasing organization set up with Andameds, so that way you can participate in that and get further discounts on wholesale medications. All right, and then let's look at labs. So we have direct interfaces with Quest, LabCorp, and then options for connecting to other labs. But we have Atlas has a national Quest account that you can join to get pre-negotiated lab rates right off the bat. And so then that'll also help set up your interface connection as well. And so that way you can order labs from the patient's chart and receive the labs back in their chart as well. And there's also, because it's a direct integration, it doesn't go through a third party like Health Gorilla or Optum or anything like that. It's a direct interface to Quest and LabCorp. It allows for much deeper lab trending features. So when the lab results come in, there's an option to import lab results in the discrete data. And that can be, you can do hashtag trend A1C, and it'll pull in all their last A1C results. And then you can take it even a step further, and you can tag specific lab results based on their LOINC number. So if we go in, and I'll just pull up this example. So you could say total cholesterol should be under 200 and your level is LOINC 20933. And that'll pull in the total cholesterol value from their lab test. And so you can be very efficient with lab follow-ups based on templates and pull in that discrete data through the Quest and LabCorp interface. And these would all be for client bill labs. So anything that you bill or that you order, the lab will bill you, and then you can bill the patient separately. But there's a way to import the prices, and most clinics will do a small markup like cost plus 10% markup, and just to keep that price as low as possible as a value add back to the membership. And then we do have options for connecting with specialists. So you can start a peer-to-peer review or consult case with a specialist, and this will allow you to send a case to the patient or to the specialist, so you can ask questions. The specialist is not interacting directly with the patient. It's just a peer-to-peer consult. And so the fee for this will go on your invoice with Atlas, but then it also gets added to the patient's invoice, so it's ultimately paid for by the patient. But you can consult with a number of different physicians in here, and if you need a peer-to-peer consult. And there is an option to add on the e-prescribing. So right out of the gate, you can send non-controlleds that get delivered as an e-fax, or you can set up EPCS or electronic prescribing of controlled substances, and that goes through our integration with Dr. First. The cost for that is $475 for the first year, and then $400 per year after that. It's an optional add-on, so you don't have to start with it if you're not doing controlleds or anything like that. So you can send non-controlleds right out of the gate, and that's included. Or you can sign up for EPCS through Dr. First. And we do have an option for sending custom forms to patients. So if you want to send them like a PHQ-9 form or anything like that, then patients can fill those out, and then they can come completed back into their chart as well. You can also pull in forms from other patient or from other clinics that they use and add those to your account as well, so you're not having to reinvent the wheel. All right. The software is free until you launch, so you can set up an account at any time, and we would extend your free trial until your clinic opens. And then after that, it's $300 per month per doc, and there's no long-term contract. Everything is all month to month. There's no setup fee, unlimited training and support, and everything like that. So you can kick the tires and set up an account very easily. If you're setting up a new direct primary care practice, we do have a startup kit. So startupkit.atlas.md, where you can go in and go through a checklist of things for starting up your own practice. And we've got a newer feature for Atlas Balance, where you can, if you don't want to go through a traditional bank, you can set up an Atlas Balance account to manage all your deposits from right within the EMR. And you can issue spending cards from that for yourself or staff members, so that way you can spend directly out of your Atlas Balance account. And then once you've been open for a few months, you'd be eligible, based on your processing volume, you'd be eligible for a loan through Stripe Capital. So you would be automatically sent information about that, and then the repayments come directly out of the processing. So it makes it really easy to repay those, but also have an influx of cash if you are looking to remodel the clinic or any sort of expenses like that. So anyways, that will do it for now. We can go into any questions that anybody has anytime. My name is Kirk Umber. You can contact me directly at Kirk, K-I-R-K, at atlas.md, or my cell, which is area code 785-317-4717. Thanks. Have a great day.